Hey everyone, I'm back and we're continuing our conversation on virtual appointments and telemedicine. For people joining me for the first time, my name is Dr. Ivy Branin. I'm a naturopathic doctor here in New York City, though I do work virtually, so I'm seeing patients all over the States and all over the world. And I love talking about women's health and hormones. So today, again, we're continuing our conversation about telehealth and virtual appointments. And so I wanted to talk a little bit about how to prepare for a virtual naturopathic doctor appointment. So here are some of my top 3 tips. Tip number 1, make sure your device, so your computer, your tablet, your phone, is ready and that you have downloaded any of the appropriate software. So I know what we're like year 2, 3 into the pandemic, and so a lot of us are pretty versed in Zoom, but some of us still might be new to Zoom. So definitely, if you're going to be having a telehealth appointment and your practitioner is using Zoom, make sure that you that you have Zoom and it's the latest version of Zoom and you're ready to go. There are some other platforms that your practitioner might use, and so making sure that you're reading through the emails ahead of time and you have everything set up so that you're nice, ready to go and relaxed and ready to talk about what health concerns you have for that appointment. Tip 2. Some of these tips, I have to say, are a little bit specific to the particulars of my practice and what I expect from my patients. So tip number 2 is sending past diagnostic work, labs, and completed new patient paperwork ahead of time. I have in my confirmation emails, I do have that as a recommendation, but I highly recommend the more information, specifically again, if you're working with me, I can only really speak for myself. I always appreciate it when specifically my new patients send me their labs and diagnostic work ahead of time. So it helps me prepare for the appointment and it makes the appointment run as smoothly as possible versus during the appointment, you're like, oh, yes, I did have my thyroid tested 2 years ago, or yes, I have had my hormones checked. I'll get that back to you. One of the things that I really use a lot in determining my treatment methods is based on both past diagnostic and lab work and then current, because it's not just even about some of the things that show up in your labs, but that might trigger me to make a determination of some other labs that might need run. And unless I know whether or not you've had them, I couldn't properly make that determination. So it definitely, it can slow down the actual appointment, and then it can also slow down getting the patient the recommendations they need, both from supplementation and diet, but then also any kind of follow-up labs. The other thing, as I said before, to send ahead of time is the completed new patient paperwork. So it doesn't just give me the authority to start a treatment plan with you, but it also gives a lot of background information to your case. What medications you're on, what supplements you're taking, what are some of your prior diagnoses, what are some of your family history, and it's just really important information for me as a practitioner to make best use of your time and also getting everything to you on a timely basis. Tip number 3, another one kind of specific to my practice, is supplements and medications. So one of the other things that I always prefer is that new patients send me what I call a detailed list of any supplements and medications that you're taking. So for example, if you're taking calcium, I want to know, is it citrate, is it carbonate, and how many milligrams that you're taking. The other thing for patients, some of my patients are new patients, what they'll do is they'll send me a picture. So maybe they'll take a picture of this and they'll send it to me, and that's fine because then I can look at that. before the visit, or have the products readily available. I also, because I work a lot with acne, I also ask that my new patients be ready to talk about what they're doing topically. What cleansers are you using? What moisturizers? Are you using any prescription topicals? This is really important, so then I can, again, the more of this information I have up front versus if the patient just has a vague idea of what they're taking, that can hold up my recommendation. So a lot of these tips are just to make sure that the appointment runs as smoothly as possible, and that at the end of the appointment, my patient can have a plan that they can follow and get started as soon as possible. I really like to be as efficient as possible. So what actually is the process from booking the appointment to getting ready for the appointment, and what happens during the appointment, and then what happens after the appointment? So typically, most of my patients will either book that first appointment by going directly to my website and accessing my online scheduler, which is pretty straightforward. You go on there, you select the day that you want and the time that you want. Some patients might also contact my assistant at info@Simplicity Health Associates. Her name is Camille, and she can also help either with the navigation of the online scheduler, or she can also go onto my scheduler and see what appointments are available. Once the appointment is booked, the patient will receive a confirmation email, and this will kind of explain some of it. So in the confirmation email, there's a link to the new patient paperwork, which the patient will fill out. It discusses some of the logistics of, again, how I said before, how I like past labs and diagnostic work, and the detailed list of medications and supplements. And also in that confirmation email, there is a tutorial of how to use the electronic patient portal. So how to create a login, and when you log in, how to view your visit summary, which will have all the recommendations of the appointment, and how to use the messaging system. So the unfortunate thing is sending things via email, like regular Gmail, is not technically HIPAA compliant. And I also like the fact of using the messaging system through the portal. Everything is also nice, neat, and organized, and in the same place. On the day of the appointment, the patient will receive the link, the Zoom link to the appointment, and then the patient will, at their time, log in and the appointment will start. During the visit, I take a detailed history of the patient's chief health concerns. We also go through medications. I will talk about their past labs that they have shown me, and then at the end of the appointment, I will discuss my impressions of what I believe is going on, or what we say is like the gravity of the case, or what are the chief areas that I want to focus on for the case, and also start my patient off on recommendations, which may include, or always kind of include, maybe some different herbs, nutrients, nutrition recommendation, lifestyle recommendation, and then, as I was saying previously, I might want to go a little bit deeper into some labs and diagnostic work, and so I might make some recommendations of different labs and diagnostic work. The patient then will be able to access all those recommendations by logging into the patient portal. The patient will also receive a prescription via my online dispensary, where the patient can, if they choose to, select the supplements, the herbs, the nutrients that I'm recommending. I always have sort of like a bridging appointment, a very short phone call in between the first appointment and the subsequent follow-up appointment. And this check-in call is just to see, has the patient started the plan? Has there been anything that they find might be difficult for them to get started, and we can talk about that and how we can troubleshoot and find a solution, and also to help like clarify any questions specifically when it comes to starting any kind of new dietary recommendation. Often patients have a lot of questions of like what products are appropriate, what do I eat for breakfast, and so that's a really good time to tease out any kind of issues that could inhibit the patient from following the recommendations, so that 2 to 3 weeks to a month after that first appointment, they have been able to start the recommendations and they're on their way to getting better. So now that was all about sort of the process and some of the tips and that I recommend when it comes to telehealth and virtual appointments. Now to book, if you have not yet booked an appointment, we do have a link in the description of the video. And of course, as I said before, you can always contact my assistant, info@simplicityhealthassociates.com, or just simply go to my website and access the online scheduler there. So if you liked today's video, don't forget to like it. And of course, please subscribe to my YouTube channel. I'm always adding new content geared towards women's health and hormones. I'm also gonna be putting up, I gave a talk a few weeks ago all about DIY naturopathic home remedies. So these are some of my favorite home remedies, and we're gonna be uploading a lot of clips from that talk, and it's really, really good, and hopefully you'll be able to check that out. So definitely don't forget to subscribe. Thank you, everyone. Again, my name is Dr. Ivy Branin. I am a naturopathic doctor here in New York City, working virtually with patients all over the states and all over the world. I'll see you next time.